follow me, the treatment of this patient will be demonstrated. Major, will you take over, please?
Yes, sir. While we are waiting for the patient, let us review some of the drugs used in narcosis therapy and chemical hypnosis. The drugs of choice are the barbiturates. The most practical one for producing and maintaining narcosis is this one, sodium amytal. There is an ample supply of it in your number 2 chest. On the average, 9 to 12 grains will produce adequate narcosis for from 7 to 8 hours. When he wakes up, the patient can be fed and taken to the latrine. This dose of amytal may then be repeated, and the narcosis thus continued as long as necessary. Patients with fully developed varieties of combat exhaustion will require a minimum of 24 hours of continuous narcosis. Some will require 48 to 72 hours. A second barbiturate with an action almost identical with that of sodium amytal is Nembutal. 4.5 to 6 grains every 7 or 8 hours. You will note that in combat exhaustion, massive doses of these drugs are needed in therapy. A third barbiturate is the familiar drug phenobarbital. Tablets are 1/2 grain. 4.5 grains will usually produce adequate narcosis, but on occasion, 6 grains may be necessary. You can expect sleep for longer periods than with sodium amytal or Nembutal. Its action may be estimated at 10 to 12 hours, after which you may proceed as with the first 2 drugs. Another drug available to you is sodium bromide. Its use is suggested only when others cannot be obtained. Dosage is extremely variable. Its action is inconstant, and it tends to pile up in the bloodstream so that toxic states may develop. In an emergency, inhalation anesthetics such as ether may be used to put a struggling, panicky patient to sleep quickly. Drugs may also be used intravenously. A 10% solution of sodium amytal may be administered with orthodox technique. The rate of administration is 1 cubic centimeter a minute. The average patient will go to sleep after the administration of 5 to 8 cc's and will remain asleep for 7 to 8 hours.